When it comes to managing glucose levels in individuals with type 2 diabetes, oral medications play a significant role. Among these medications, two popular options are Glimepiride and Glyburide. But how do they compare in terms of effectiveness and safety? This video aims to shed light on the key differences between Glimepiride and Glyburide as oral diabetes medications. Overview of Glimepiride and Glyburide. Glimepiride and Glyburide belong to a class of drugs known as sulfonylureas. They work by stimulating the pancreas to produce more insulin, which helps lower blood sugar levels. While they share a similar mechanism of action, there are some important distinctions to consider. Glimepiride, also known by the brand name Amaryl, is a second-generation sulfonylurea. It is known for its longer duration of action, which means it remains effective for a longer period of time. This can be beneficial in ensuring better blood sugar control throughout the day. On the other hand, Glyburide, also known as dia-beta or micronase, is a first-generation sulfonylurea with a shorter duration of action. Mechanism of action of Glimepiride and Glyburide. Both Glimepiride and Glyburide work by binding to specific receptors on the beta cells of the pancreas. This binding stimulates the release of insulin, which then helps to lower blood sugar levels. By increasing insulin production, these medications enhance the body's ability to utilize glucose effectively. It is worth noting that Glimepiride has a higher binding affinity to the receptor compared to Glyburide. This means that Glimepiride is more potent in stimulating insulin release. Additionally, Glimepiride has a higher selectivity for the pancreatic beta cells, resulting in a lower risk of adverse effects on other organs. Efficacy comparison of Glimepiride and Glyburide. When it comes to efficacy, both Glimepiride and Glyburide have been shown to effectively lower blood sugar levels in individuals with type 2 diabetes. However, studies have suggested that Glimepiride may be more effective in achieving and maintaining target glucose levels compared to Glyburide. A study published in the Journal of Clinical Endocrinology and Metabolism compared the efficacy of Glimepiride and Glyburide in 86 patients with type 2 diabetes. The researchers found that Glimepiride achieved better glycemic control, with a higher percentage of patients reaching their target HbA1c levels compared to Glyburide. Safety profile of Glimepiride and Glyburide. When considering the safety profile of Glimepiride and Glyburide, one important factor to consider is the risk of hypoglycemia. Hypoglycemia occurs when blood sugar levels drop too low, leading to symptoms such as dizziness, confusion, and in severe cases, loss of consciousness. Glimepiride has been found to have a lower risk of hypoglycemia compared to Glyburide. This is due to its longer duration of action and lower peak concentration in the blood. The risk of hypoglycemia is particularly important to consider in elderly patients or those with kidney or liver impairments, as they may be more susceptible to the effects of low blood sugar. Side effects of Glimepiride and Glyburide. Like any medication, Glimepiride and Glyburide can cause side effects. The most common side effects associated with sulfonylureas include gastrointestinal symptoms such as nausea, vomiting, and diarrhea. These side effects are generally mild and tend to improve over time. In rare cases, sulfonylureas can cause more serious side effects, such as allergic reactions or liver toxicity. It is important to seek medical attention if you experience any unusual symptoms while taking Glimepiride or Glyburide. Choosing between Glimepiride and Glyburide. When choosing between Glimepiride and Glyburide, it is important to consider individual factors such as medical history, overall health, and lifestyle. Consulting with a healthcare professional is crucial to determine the best choice for your specific needs. If you have a history of hypoglycemia or are at a higher risk for developing low blood sugar, Glimepiride may be a more suitable option due to its lower risk of hypoglycemia. On the other hand, if cost is a significant factor, Glyburide may be a more affordable choice as it is available in generic form. Guidelines for dosing and administration of Glimepiride and Glyburide. The dosing and administration of Glimepiride and Glyburide should be determined by a healthcare professional. These medications are typically taken orally once or twice a day, with or without food. The dosage may vary based on individual needs in response to treatment. It is important to follow the prescribed dosing instructions and regularly monitor blood sugar levels to ensure optimal glucose management. Adjustments to the dosage may be necessary over time to maintain target blood sugar levels. Considerations for special populations. In certain populations, such as the elderly or those with kidney or liver impairments, special considerations may be necessary when using Glimepiride or Glyburide. These individuals may require lower dosages or closer monitoring to minimize the risk of adverse effects, particularly hypoglycemia. Pregnant or breastfeeding individuals should consult with their healthcare provider before starting glimepiride or glyburide, as the safety of these medications during pregnancy or lactation is not well established. Conclusion and final thoughts. Glimepiride and glyburide are both effective oral diabetes medications that can help manage glucose levels in individuals with type 2 diabetes. While they belong to the same class of drugs and share a similar mechanism of action, there are important differences to consider. Glimepiride offers a longer duration of action and a lower risk of hypoglycemia compared to glyburide. However, individual factors such as medical history, overall health, and lifestyle should be taken into account when choosing between these medications. Ultimately, the decision of whether to use glimepiride or glyburide should be made in consultation with a healthcare professional. They can provide guidance on the most appropriate medication based on individual needs and help develop a comprehensive diabetes management plan.